Hello everyone, welcome to my channel Ravi Study Physio. So in the series of medical physiotherapists, laws and ethics, let's discuss about ethical documents for physiotherapy. So what kind of documents is essential for physiotherapy during the treatment procedure, before the treatment procedure, and after the treatment procedure. So let's discuss about it and how you can write in university examination for achieving a good marks. So introduction: documentation is a material that provide official information or evidence that serve as a record. So you have to be for the study purpose, case study purpose, written the thesis or represent the case study into the national or international level for as a doc. So it is mandatory for you can keep research and make a documentation into the hard copy or also the soft copy into the patient in by case-based study. The medical record of the chronological written account of the patient examination and treatment that include the patient medical history and complaint, the therapist physical finding, results of diagnostic test and procedure, medication and therapeutic procedure. So these are some medical records for examination of the patient, the case study, the treatment protocol, history of the patient, psychological treatment of the patient, different tests, X-rays, MRIs, and CT scans. Also the treatment procedure, the method of application, different kind of gadgets use of, and also the medication. These all are mentioned to the document for the case study of the patient, for written of the patient to representing at the national level, and into the paper presentation, poster presentation, or also for the prevention of any medico-legal cases. So you have a research or data for the case study on the patient. So general guidelines of the documentation for physiotherapists or any medical staff. First is to be documentation is required for every visit. You have to make every visit record by the patient by your own hard copy and to soft copy into your database by your own hospital. All handwritten entries shall be made in a ink and will be include original signature. You have to be take a consent sign of the patient before starting any procedure and any documentation. You have to be sign on the original document on the patient. Electronic entries are made with the appropriate security and confidentiality provision. You have to be only that time there is a hard copy is not available, or you have to be both hard copy or soft copy. On that time, the electronic sign or also the saving of the data is to be mandatory with the different database or USB. So it is mandatory for the prevention of any further medical legal cases. And any for confidentiality and provision, you have to be keep secure and private of the particular patient data into the encrypted biometrics by yourself. Documentation should include indication of no source and cancellation. So documentation include all of the patient. You have to be write down to the patient have to be choosing any other option. There is other alternatives and any kind of contraindication and any kind of potential hazard it will occur on the patient. So all of are written on the patient case notes on the cancellation notes. All documentation must include the patient full name, identification number. All entries must be the dated, authenticated with the therapist full name and appropriate designation. All of the therapeutic procedure will be maintained. You have to be all the treatment procedure have to be written. Patient name have to be mentioned. Patient registration number have to be mentioned. Patient registration date have to be mentioned. Patient treatment procedure have to be mentioned. Patient test have to be mentioned. Patient psychological treatment have to be mentioned. All of this mentioned into your particular document, and both therapist and doctor you have to be signed into the digital or into the hard copy for the future relevance. Next is to be areas of documentation in physiotherapy. So where the physiotherapy have to be documentation is mandatory. First is clinics. The financial record, patient evaluation and progression record is a referral record. All of the clinics, they have to be mentioned the documentation for the patient evaluation, for the case study, for the prognosis report, and any kind of doctor referral code they have to be write down into the particular documentation. Next is to be hospitals. On OPD, on patient duty records, IPD in patient duty records, departmental records, staff records, equipment records. So these are records have to be mentioned into the documentation for the which patient and which staff have to be providing such kind of treatment procedure on the particular patient. They have to be written into the particular documentation. Hospital come college staff setups, OPD records, IPD records, student records, staff records, equipment records. Which student have to be taken this particular procedure? What is the if any kind of student come into the internship and any any student coming for the any particular university and college for the giving the particular treatment procedure and intensive procedure into the particular hospital, and IPD, OPD records and the equipment records they have to be like used on the particular patient. So all of the records have to be mentioned in the particular documentation of the particular patient. Next is to be home visit. If you are taking the home visit as a physiotherapy, so make sure you have to be keep record on the of the patient financial reports, patient name, evaluation, progression, any kind of referral records for the orthopedics and neurosurgeons. So for the future reference and prevention of the medical legal cases. So next is to a way of documentation. First is manual entering. They have to be pen or paper method for entering the data, stored the filling and folders. Legally, they are move acceptable and documentary evidence. These are difficult to tamper with the patient. Difficult for the tamper with manual entering on the patient. So that enhance the quality of the treatment procedure of the patient and therapeutic relationship and the future referral. So that entering of the pen or paper mode is to be mandatory. Otherwise, you have to be taken on the digital mode for the future reference and the saving of the data for the particular patient for the case study and thesis writing. Next is to be disadvantages. Need for large storage area and difficulties in the retrieval of records. So there is a lots of patient have to be recording of the data into the pen and paper mode is to be very much storage have to be taken. And you have to be, if not, it could be possible. So you have to be take the electronic gadgets for the saving such data. Next is to be electronic recording. I have to say about that. The medical records are computerized. These are neat and tidy and can be easily stored in a retrieve. These require a mandatory password protection and backup system, as is the safety software is to be only given to the authorized person. So these methods have to be very essential for the patient keep their confidential or also the biometric option for the particular patient data and the record for the future reference and medical legal cases prevention. Next is to be type of documentation. First is demographic report. It includes the patient name, their such a marital status, family size, case history, chief complaint, blood report, their residency or the income. It helps to care team communicate effectively. Patient will understanding the patient culture, social studies, their religion, caste, and also the identifying their financial background. Next type of documentation is to be clinical health record. Accurate, complete, authenticated, like legible information gathered the timely number by healthcare professional. So you have to mention the chief complaint, the past history, present history, surgical history, medical history, drug history, their family history. All of the things have to mention into the documentation for the clinical health records in the future reference. Uses. What is the uses of clinical health records? So aid information, decision making, and the patient management, help to scientific evaluation and the patient profile, improve time management. So these help to time management and easily assess the particular patient to what condition have to be there occur into the these diagnostic purpose. Next to be departmental records. The statistical records regarding to the number of the patient status for the equipment and revenue generation number of evaluation patient on follow-ups, number of discharge, number of treatment session. So that is a department level of how many times of session patient have to be approved in your clinic or particular hospital, how many times of you have to be educated, evaluation and the prognosis report, all of the mention you have to in particular patient data into the systemic record or also the hard copy. Next is to be financial records. The statement are used to give you much more than just a snapshot for your business health. So these records help to keep in your mind for patient have to be not have to be financially too much rich. So you have to be take some like a few their fees of the consultancy charge they can free for such patient they have not financial like good. So that is you have to be for the social help for the particular patient. Next is to be necessary for what patient mandatory. So patient with chronic condition have to mandatory to make records and documentation. Post surgical patient, a patient have to be surgery, so you have to be keep data into the record. Neurological patient for treatment process and procedure. Pediatrics patient, geriatrics patient, medical legal case patient, it is mandatory for you have to be make a documentation for such patient. Next is to be sport injury patient, patient with disability, insurance or competence claim patient. There is any kind of insurance and company claim patient like ESIC patient, so you have to be keep maintain this particular records for the patient for the healthcare records and prognosis chart. So that is the ethical documentation for physiotherapy or any medical staff to maintain the records for the future reference, and you can write university examination for achieving a good marks. Thank you.